All right. Good morning. As you know, I am your Health Plans for Less representative here in this LaTiff group, and I specialize in health insurance, small group insurance, life insurance, and Medicare. But today, I'm going to actually talk to you about Medicare. Some of you, this might be a snooze because maybe you're not anywhere near Medicare. But you may have friends that are, or parents that are going to be approaching that, or a neighbor. So it is, again, information is empowering. So if you get a few little tidbits of information that will stay with you today, it could help you in the future. Or maybe it'll give you the confidence to refer someone to me to think, oh, she could be of help to that person. So in the Medicare arena, there's two different, what I call animals, if you will, because I like animals. One of those animals happens to be what they call a Medicare supplement. And a supplement essentially is what you add to Medicare itself. So, and how do you qualify for Medicare? I get calls when they're turning 62 and they say, can I get Medicare now? And we're like, no. You qualify for Medicare when you turn 65. Social Security, you can get at 62 if you want to take it early. But Medicare, you're eligible at age 65. So your birth month. So if your birthday's May the 31st, you can get it May 1st. It'll start the first of the month of your birthday. So that's when you're eligible for Medicare. And Medicare, if you are a citizen of the United States and you have paid into it, if you notice on your stub it'll say Medicare and they've taken out a deduction monthly. If you pay into that at least 10 years, then you become eligible for Part A when you turn 65. And Part A, I don't know why they call it Part A. They should just call it hospitalization because it would be a lot more clear than what is Part A, or Part H maybe, but it's called Part A. And it's for hospitalization. And hospitalization then, if you qualify, you don't pay for that. It becomes a no-cost coverage for you for hospitalization. There is a deductible, so if you go in the hospital, you'd pay that deductible. If you do not qualify, then the premium for that is in the $460 range or more. But on average, that's about what the premium would be for Part A. So most of us, though, we will qualify because we've paid into it for at least 10 years and we are a citizen. Okay? And so self-employed people, make sure you're paying into that. If some people are not aware of that, they don't pay into it, and then they're caught, what? I don't have this? I have to pay $450 a month? So make sure you're paying into that. Make sure you pay your taxes, even if you are a corporation, that you have payroll, that you are paying into that. It will be a blessing to you. Okay, so that takes care of Part A. Now there's another section called Part B. That's all your outpatient services. Well, anything that's not related to the hospital is called outpatient services. So it doesn't matter if you go to a specialist, a general practitioner, you go in for outpatient surgery, you go and have blood drawn, you have an MRI, all those things not related to the hospital experience being admitted are outpatient services. And those, if you only have, if you don't sign up for Part B, of course you're 100% responsible. If you do sign up, or if you get Part B and you pay this premium, it's a set premium based on the income that you make. And Medicare will determine what that is. Right now, the premium's about $120 a month for a new person coming into Medicare and purchasing Part B. You have to have both of those pieces in order to sign up for a Medicare supplement. If you do not have both of those pieces, you cannot sign up for a Medicare supplement or a Medicare Advantage plan. So those are two elements that are required for you to even get into a plan through Medicare. Okay, so the Part B, again, are outpatient services, Part A, hospitalization. Then in 2006, they instituted a new program called Part D. And this actually makes sense because Part D is for drugs. That makes a little more sense to me, So Part D becomes your drug coverage. And there's over 100 different plan options. So it becomes very complicated. What is the best plan for me or for you? Well, what drives those decisions is what drugs you take. And each formulary, they call it a drug formulary, constitutes different drugs. One may cost $12 a month and cover very few drugs. One may cost $135 a month and cover extensive, very expensive drugs, depending upon what your needs are. So of course, what I do is I have a software system that I put in all of the drugs that a person would take, and I can look to see what the copays are going to be based on their pharmacy of choice and what their exposure is going to be, and anticipate those costs before they get into any plan. And that way you don't have to go out there and try to figure it out. It's really difficult to do it on your own if you don't have the right tools, just like a plumber. If you don't have the right plumbing tools, you can't get the job done efficiently. So it's the same concept with health insurance and drug coverage. And then I only represent the big boys. I only represent the carriers that I know pay their claims. I know they've been around a while. I don't use any of the I know this is being recorded. I don't use any of the new carriers until they have a proven track record, because I don't want to have you guys, when you need a claim paid, have a problem and then it comes back on me because they don't pay their claims. So it's really important that I use quality carriers. We have relationships with those carriers. We've been in the industry over 20 years. When a problem develops, we have contacts that we go to that we have, again, relationships with, and we problem solve, because health insurance has problems. It doesn't matter which carrier you go with. There's things that come up with every carrier. Because you're dealing with an industry that's complicated, that has lots of moving parts, not just one part or two parts, but lots and lots of moving parts. You're dealing with human beings that make mistakes, that tell you one thing and it's another, and then you've got to go back and you've got to try to fix things. And so it's just really helpful if you, when you're to be able to use someone that has relationships and knows about the industry and is staying on top of the changes. And it is, as Terry said when he introduced me, it is an industry that's evolving every day. There's changes, and there's going to be more change. And so if I weren't flexible and able to adjust to all of what is happening in the marketplace, I wouldn't be in this business, because you will drive yourself crazy. So you have to be flexible. You have to be, I think, moderately temperate in personality to be able to deal with all the challenges that it can present. But the good news is, because I have history in the industry and I understand it well, and I think I'm pretty good at problem solving, I'm here to help you in any way I can, whether it's a good fit or not. You know, sometimes I talk to people and I can't make it better than what they already have, and I say, keep what you have. So I will be honest with you and always do my best for you. So getting back to Medicare specifically, so you have Part A, Part B, Part D is for drugs. Okay, now so when you go and you're looking at plans and you say, do I want a supplement or do I want an advantage plan? Those are the two arenas, or what I called animals earlier, right, in the Medicare marketplace. And within the supplemental arena, probably the most sought-after plan or purchase plan is the F plan, because it covers 100% of everything. You can spend a little over maybe $220 a month on average, and have it cover everything except your drug copay. So for some people, that's a fantastic option. And if the doctor takes Medicare, it picks up 100%. If you're paying premiums and you're 64 and you know what the cost is, you're excited about that option, right? Now, as you age, of course, the premiums do go up like everything else, okay? That's for somebody who's 65 aging into Medicare. Now, for those of you that want an Advantage plan, typically they're your HMO plans like SCAN, Kaiser, Blue Shield 65 Plus. They have a Medicare Prefer, Medicare Access plan with Blue Cross. It's a PPO. There's lots of options out there that can work as well, but they're limited on how you can use them. And there's no premium cost to them, but there are limitations, and you usually have to work within the confines of that plan. But that doesn't mean it can't work for you. So fortunately, we're in Orange County. Orange County is a metropolis of good doctors, good hospitals. You don't have to go very far. You know, I had a client that moved up north, and she's like, what? No Advantage plans up here? And I said, well, honey, you're out in the sticks. You know, there are no doctors. You got to drive 25 minutes to get to the nearest doctor. You know, but that's where they wanted to live. So I said, you got to pay this couple $100s a month now, but the beauty is you get to live out in the country. You know, as a trade-off. So she said, well, okay, I guess that's true. But there were no Advantage plans, nowhere to be found. I couldn't find her anything that was available. So we live in Orange County. There's lots of choices here. So you can get, many people, well, I can make an Advantage plan work. And there's a $0 cost to that per month. You do have to pay your Part B premium, which goes straight to Medicare, because without that, you get no plans, right? So you have Part A, Part B, and Part D. But the beautiful thing about this Advantage plan is it incorporates the drug plan, or Part D, into it. And so you don't have to buy a separate plan. And probably you guys are starting to gloss over a little bit. But anyway, and I get it, because it's complicated. There's lots of moving parts. But I just want, it's like Scooby-Doo, right? Scooby-Dooby-Doo, where are you? But I just want you to know that when you're looking for a Medicare plan, what I always ask people, the most important questions are, who are the doctors that you want to keep? What are their names? Where are they located? So I have the right doctors. The next question is, if you got sick, what hospital do you want to go to? Is it Hoag? Is it Talbert? Is it Fountain Valley? Is it, Saddleback? Wherever it is you want to go. And then secondarily, what are the medications you're taking? How much and how often? What is the pharmacy you want to go to? Can we try to keep normalcy with everything as much as possible? So if we can do that, and I can get you into a lower cost plan or something that will work, great. And I can give you those two options. And look, say this is my first choice, second choice, maybe third choice. And then you're able to look at the information, assimilate it very quickly, and make a decision. Some people say, I only want a PPO. Well, that knocks out a ton of plans, narrows it down very quickly. And so I can say, now I'm looking for the best cost to coverage for that same plan. Because I always say an F plan is an F plan is an F plan. It doesn't matter if you go to HealthNet, Blue Cross, Blue Shield. I'm just looking what's the most competitive. Are they paying their claims? That's really what I'm interested in. So anyway, I'm always driven by those. Those are the key elements. I run it through all of the information that I have, then make a recommendation based on that. And then, like I said, it just takes some time and experience to narrow it down. Otherwise, you're going to get a mountain of papers, maybe this tall, and they dedicate a tree when you turn 65 in your name, and print all that Medicare information. And as you can see, I put out some of the Medicare and I think it's, Chris, underneath your portfolio there. Just hold that up. That's just one piece of information on Medicare, and you can see how thick it is. So most people are not going to take that and read through that. So unless you're one of the analytical types, you might do that. There are a few. There are a few that actually read everything, but that's a rare individual that will do that. So, but why not, if you want to save yourself time and you want to save yourself a lot of headache and you want to make sure you're getting what is best for you, then you can be confident to know, hopefully by me speaking today and having a relationship with you and done business with you in the past, that you know, oh, she can help my client or my friend or my mom. And even if they're not 65, open enrollment for Medicare begins October 15th through December the 7th. And at that time, people have the opportunity to make a plan change should they like to, if they're in an Advantage plan, the HMO Advantage type plans. Now there is, in some areas, a PPO, but it's not available in all areas. It's called an Advantage plan, and I think a couple people in this room I know have it or have had it. So, but that's the time to make a change if you have an Advantage plan, and then it affects the effective date would change then on the 1st of the year, January 1st. I have 1 minute left. Thank you, sir. So that's important to remember. If you're in a Medicare supplement plan, the only time you can change is the month before your birthday to go into a different Medicare supplement carrier. So a couple of different rules. There's some other, of course, what they call SEP rules or special enrollment period that are taken into consideration, but I'm not going to bore you with those details. If you have that circumstance, I'm more than happy to address it and try to discern what's best for you. Do you have any questions about Medicare? Anybody? Yes, a couple of questions. Go ahead. Sally.
As far as the PPO goes, is Blue Cross the only one that's out there?
That's a good question. She says, is Blue Cross the only PPO? Aetna does have a PPO, and it's about the same. It's really hardly worth changing to. The difference is Aetna, when they pulled out of the marketplace out of California, when the initial changes happened a few years back, they completely went off the Medicare replacement market, and then now they just came back. So I'm just kind of waiting to see what they're going to do, because they didn't hang in the marketplace like Blue Cross did. So they're a little, I like companies that are going to be in it for the long haul, for my clients. Yes.
We have Kaiser right now. Will I be able to keep Kaiser?
Yes, you can. Kaiser has, it's a unique situation with Kaiser. I do not represent Kaiser in the Medicare arena. They have no brokers. However, if you have Kaiser now, they will offer you, they'll start sending you the information when the time is appropriate for you to get Kaiser, should you want to enroll in one of their plans. But if you want to do anything other than Kaiser, I can assist with that. But if you do choose to stay with Kaiser, then you would just get the information directly. Yes, Mr. President.
I hear you have a great husband. Would you like to talk about him?
Wow.
Say no.
How much time do I have? I'm sorry. I can't answer that.
Just don't have enough time. It's just too much.
Did you have a quick question?